we're still here. Like when it was so grim that we didn't really see any light at the end of the tunnel, we persevere, we fought, and we pushed through, and we start seeing like groundbreaking science, being developed and also being used now, in other healthcare delivery systems. And I think that it's phenomenal. But we need folks who have seen that development to help share these stories so that we can create a blueprint.
Welcome, everyone, to the Commonwealth Club World Affairs of California. I'm Michelle Miao, a member of the Board of Governors for the club and also a producer and programmer here at the club. I produce a program called The Michelle Miao Show. It's your A through Z covering the LGBT, LMNOP, and everyone in between. Today, I should say, we had a very special program in which we linked our youth scholars who are actively working in the HIV/AIDS space with our second panel, which are experts, community advocates, and activists, professionals who have been working in the HIV/AIDS space for many years. And the reason for that is we obviously know that there have been many changes from the federal down in terms of impact to the work that we have done, from research, from our path to health equity and access and advocacy, to science, to all of that has been affected and impacted. And so the second part of our program is going to focus on what those impact actually mean. And so let's welcome to the stage Dr. Tyler Tamir, who is the Executive Director of the San Francisco AIDS Foundation.
In this particular moment, we find ourselves at a really dangerous inflection point in the fight to end the HIV epidemic. What once felt within reach now feels increasingly fragile. And as leaders committed to health justice, we are watching decades of progress come under attack, not only through rhetoric, but through targeted federal action designed to destabilize our sector, erase our communities, and unravel what remains of public health infrastructure in our country. And tonight I'm speaking not just as the CEO of San Francisco AIDS Foundation, but as a Black queer man who has been living with HIV for over 20 years. I was diagnosed in my early 20s, young, scared, and searching for a place in the world that too often rendered people like me invisible. It was community that held me, that educated me, that gave me hope when systems failed to. And today, I carry that experience with me into every conversation about public health, because that's what's at stake. It isn't theoretical, it's personal. The policies that we discuss in rooms like this one ripple out to real people trying to survive, to love, to build futures with dignity. We can't afford to let political hostility, apathy, or fear strip away the hard-won gains of this movement. Our lives and the lives of those who come after us depend on what we choose to do in this particular moment. So as we get started tonight, I'd love for each of my colleagues here to just introduce themselves, their name, their pronouns, and where you work or your affiliations.
Okay. So I guess I'll start first. My name is Cecilia Chung. I'm the Senior Advisor at Transgender Law Center, and my pronouns are she and her.
Hi, my name is Lance Thoma, he, him pronouns, and I'm the CEO of San Francisco Community Health Center.
And I'm Carl Schmid. I'm Executive Director of the HIV and Hepatitis Policy Institute in Washington, D.C. He, him.
Great. So I think we're just going to dive right in because there is a lot of ground we could cover in this particular moment in our political sphere. So we have seen executive orders and budget proposals that are threatening to gut HIV prevention and our care infrastructure. What are the most immediate consequences of the Trump administration's rollback of programs like Medicaid, Ryan White, and LGBTQ health services for people who are living with HIV and the organizations that serve them. Let's maybe start with Lance.
Thanks, Tyler. I mean, that's a tough one because I think the answer, we don't want to face it. But, I think we're really headed towards a potential future where we will see the dismantling of organizations that we hold dear. I do think the funding that gets at risk are supporting smaller HIV community-based organizations that we've fought long and hard to build over these decades and are reaching some of the most marginalized community members. And I think those are the very ones that are relying on federal resources because we fought for that. Right, we fought for data to prove that these organizations are needed, and federal funds are going to these organizations and supporting them. So I think there's that, and then I also think that there are our federally qualified health centers are also at risk when we're thinking about Medicaid. That's right now on the chopping block. In Congress, and we think about what ramifications that has for folks who are living with HIV and the care and the comprehensive wraparound care that health centers, LGBTQ health centers, offer and provide and go above and beyond with respect to the meeting community where they're at, meeting clients where they're at, and building community. I think all of what all of the organizations I'm referring to are simultaneously, we get that it's not just about prevention or care or treatment, it's about belonging and building community and ensuring that folks are not alone in this, in their health care. And I do think that's what our organizations do, and that's what I feel like is at risk right now.
Anything you'd add, Carl?
Yeah, I mean, since day one, we've been under attack. First with the executive orders and, anti-trans, anti-DEI, anti-immigrant, and somehow that all converged on HIV programs. And then it was because of those executive orders, they canceled all these research grants. And it's really been focused on HIV because it's such a stark contrast from the first Trump administration. So we didn't expect it to be this bad, but but it looks like because of Elon Musk and first of all, I think we have to recognize that there's just a whole anti-government, and we're caught up in that. And our programs are funded by the federal government. And so they want to reduce government spending. So we've been wrapped up with that. And I think somehow a lot of our programs focus on certain communities. Well, why? Because that's where the epidemic is. And so they've gone after our programs. Also, RFK, who is our Secretary of Health, said we're going to take a break from infectious disease and we're going to focus on chronic disease. And I think HIV is a chronic condition. It's an infectious chronic condition. So it's just been, they canceled all the research grants they're focused on a certain population. And then they started cutting the staff at the CDC. And it's just, I think everything's been decimated. Everyone feels like what is the next shoe going to drop? Everyone's walking on ice, afraid to do anything. And meanwhile, as you said, the people are impacted and hurting right now.
Do you want to add?
Yeah, kind of. But I think that Carl and Lance really already illustrated most of the challenges that we're seeing. But I do remember the speakers from the panel before talk about intersectionality, and I think that that's where we are really seeing how it impacts us in a very different way, because like for the undocumented, like we already are hearing, like proposals of like cutting back on fundings to support their healthcare. And we also have heard stories of ICE going into different places unannounced and conducting raids. And so all those things are going to like discourage people to like come forward to get tested, to get care, and really to like take care of themselves. And it's the same thing for the trans community. We're already hearing stories about trans clinic being closed, not in San Francisco, but in other parts of the country. And it's really crucial to really look at the history why transgender clinic was set up in the first place. It was because we were seeing a lot of advanced diseases being presented from the community. And so that's why clinics like Tom Model decide to like open it up for gender affirming care and to provide hormones and, and support. And that's how it's all started. So now when we are going to like eradicate these programs, it's pretty much going to harm the community in ways that we can't even imagine yet. We have never been like in such a dire situation, and so in some ways we're all flying blindly right now. And I think 1 year from now, when we get some data back, we will really see the damages.
Yeah, let's stay on that topic for a minute. I think the administration has really explicitly been targeting transgender, non-binary, and gender expansive individuals through both policy and rhetoric. How do we see the administration's policies targeting these communities impacting HIV transmission and health disparities? And what do we risk losing if these communities continue to be legislated out of existence?
Well, I think that the caveat is we're not being legislated out of existence. We're being executive ordered out of existence.
Yeah.
And, and none of that actually have gone through the legislative process. And I think in some ways I'm more upset with the legislators than I am with, the White House, because it's one thing to have executive orders, but, but the legislative branch did not challenge any of that,
exactly.
Including, authorizing fundings. So it came as a surprise to us to begin with. And also because of that, we are seeing, the administration's doing things like pretty much before it's even got passed in Congress, or, even when there are judgment against them implementing it, or, that there's injunction from them to implement some of these executive orders, they went ahead and do it anyway. So, we are actually in a time, I hate to say that word, autocracy, or even dictatorship in some ways, and so it's hard to know what's going to happen next. And for us, without the proper data, it took us years to advocate for inclusion of data for trans and non-binary people, let alone, really dig into the nuances of what ethnicity means and, and racial diversity. So the erasure of DEI also means that the erasure of some of these data collection system. And so on paper, we are anticipating being erased, but we know that before all this happened, the community had done our creative ways in coming together. I'm talking about the early days of the epidemic, when I was 20. And that we know, from our experience, that there's a lot of lessons that we learned from then that we can apply now. But we need an action plan.
Yeah. I mean, what I would add is the executive orders, they are only executive orders, and yet the impact is actually real, right? Like when hospitals or organizations actually then withhold care because they're scared because of this executive order that the White House issues on DEI or gender ideology, it has an impact. And the intersectionality that Cecilia, you mentioned, at San Francisco Community Health Center and our Trans Thrive facility, what we see is that we have so many folks who are trans who have come to San Francisco or because from their home country, because they have been persecuted and it's a life and death situation, and they've come here seeking asylum, or they come from other states and cities where they're fighting for their lives, where their lives are in jeopardy, and they come here, and now in a nation where there's this potential erasure of trans folks, or just even that our community. Folks are not going to get the care that they need. They're not going to get tested. They're not going to get the preventative care. Everything that we've worked so hard, all the structures that we've done, and all the efforts we have made to create trans competent programs and services, or gay men of color competent programs and services. That's where I get so scared. Because I feel like these are the folks that we've worked so hard, and these are the exact folks who are getting targeted by these executive orders. And then no protection from the legislative branch or our legislators. And then where do we turn? And I think that's when we're starting to talk about litigation and using that part of our efforts in order to save what is there.
Yeah.
I was going to say, thank God for the courts, that we are still, can have recourse in the judicial system. Yes. And because you're right, Cecilia, it's executive order is an executive order. And I'm glad to see people fighting back for data protection, for making sure that people get the services. I mean, yes, we could say that they are erasing the trans community in their data, but they cannot erase trans people. And we still have to, and yes, people get funding from the federal government, but we all have, as you said, built up these local clinics, and they can't turn their backs on the trans community or anyone. And so that's where maybe, state governments, local governments, private funding has to ensure that we, I don't know why, we'll probably talk more about it, why it's happening now, but, trans people have been around for thousands of years. So it's nothing new, and you cannot erase people from this earth, and we have to fight back, and I know we are, but yeah.
Yeah. I mean, we've mentioned data now multiple times, so maybe we can talk for a minute about the fight for data and truth. What does it mean that we're seeing all of this data start to disappear, that they're wiping data from websites both around HIV-specific data, but also trans and non-binary specific data? How is that serving them politically? Why do we think they're doing it? And how do we protect the truth when they're attacking the data itself?
Yeah, well, they are attacking the data. Why? They feel that it should be, everything, healthcare should be for everyone. And it doesn't matter if you're black, white, trans, gay, Latino, even a woman, they seem to want, not everyone's the same in this world or in this country. And there are differences in people and different needs of people, but they don't seem to, they have this one idea of who is an American these days. And notice I said American because they only want, certain Americans, it seems, and, yeah. But so again, we have to collect our own data, local groups, I guess, but we cannot. We have avenues, I think, to to call them out, and through congressional hearings, and there's the Congress is relatively evenly split. And there's still the podium and that the Democrats get to ask these questions about data and the truth and the science that they're erasing as well right now, and to call them to the carpet. And also the media is the other way of bringing these to getting the real facts out there as well, because there seems to be a lot of alternative facts these days in ignoring science.
Well, when I was thinking about data, I was just thinking it's not long ago that we were fighting for data on APIs and native communities, right? Like we were other until very recently. We didn't know what the epidemic of HIV was for the API community or the Native American community, and we had to fight for years and years and years for CDC to collect this data, and only then could we understand the impact of HIV on our communities. And that was so critical. And I just think as soon as now we start to see the disparate impact in Black and brown communities around HIV, or gay men of color, for trans women of color, I just think that that's a threat. And when you take away data and you start to then erase the data, you don't erase the people, you erase the data. But what it says is that we're disposable. Like there's a way that says, you know what, yeah, let's treat everyone like we're all the same. And we're not the same. That's why we know that health inequities exist because of race and gender and sexual orientation. We just know that, and that's how we have become and fought for our comprehensive health and wellness. And so I do think when you start dismantling the data, it is who's going to be impacted. It's the folks that are being targeted in these DEI and gender ideology executive orders, and it's those communities that are disposable. And that's where I feel like the fight has to happen. Everything that we've learned to do, how we had to get the data on the API native communities, we got to do it again. And it was Congress, it was working with HHS, it was working with White House, it was working at all levels. And I appreciate Carl, media, and it is. We have to use everything in our power to make sure that we're focused on the facts and
It seems like in this particular moment, they have really also honed in on HIV prevention in particular. What do we think is behind that, and what's driving the focus on prevention versus some other areas?
I'll go first. So I think that, it's actually, it's on the same on the same line as how they are going against, reproductive health and reproductive justice, and, especially for the, birth control pills, because somehow in their mind, it translates to promiscuity, and that's not a very Christian thing and whatnot. We know that those are all excuses, but that's the kind of framing that's happening. Like, how are you going to argue with God if you believe in God? So I think that it's really important for us to push back on some of these narratives. And it's really not about being promiscuous, but it's about caring for ourselves, being more proactive in our own healthcare. That's why we want to make sure that we prevent, diseases. We want to make sure that we have a say in what we want for our bodies. So we still need to work out some of these narratives to counter that that element, that's floating around that nobody's arguing. Like, who would have thought, because bathroom is pretty much the place where we spend the least amount of time in our lives. But that's what they're focusing on, and it can create such a huge moral panic to the point that, people are up in arms to, getting ready to erase the trans community. It just didn't make a whole lot of sense. But unfortunately, I guess it doesn't matter whether it makes sense or not these days. It's really that fear of the unknown is playing tricks on everybody. So that's, yeah. I want to save some. Actually, I think there's some silver linings, but I'll save that for the end so we don't have to end on the negative note.
Yes, that sounds great.
Well, first, you're right. They are focused. They're going after prevention. So the good news is, the Ryan White program is basically intact, and which is providing, care and treatment to over 500,000 people living with HIV, and they are, it seems, moving forward with that. In fact, they just gave out a 5-year contract to all the jurisdictions that get the Ending the HIV Epidemic funding for 5 years. So that's a good sign. I think we're going to, hopefully, we'll see in the president's budget, have the Ending the HIV Epidemic funding for the Ryan White program. And Cecilia, well, maybe we'll take a bet. And but they are going after prevention. It's really sad because we have such great hope on the horizon with PrEP, particularly. We have daily oral PrEP. We have once every 2 months, and hopefully in the next couple of weeks we're going to have every 6 months, which is just amazing, and hopefully soon, once a year injection, once every month pill. So here we have the science, and we're losing the infrastructure, and so prevention has always been a little more esoteric than giving people a drug and to keep them healthy and alive, and it's easier to count that. And it's hard to measure prevention. And as Cecilia said, HIV is mostly sexually transmitted. It predominantly in certain communities in our country. And it gets all wrapped up in the DEI message. Also, remember, this administration is very anti-CDC because of COVID. And so I think they're very suspect in the CDC and prevention, but we have to fight back. And I think one of the messages that we have to talk about is, if they are so into treatment, but connect the prevention work with treatment, because there is no HIV treatment until you have HIV testing. There's no PrEP until you have HIV testing, and all the surveillance data. Where are you going to do your testing? And so I think we have to kind of, connect prevention to treatment a little better.
Yeah.
But they are going after prevention. The sad thing is, I talked about the 5-year grant for treatment. For prevention, they're only giving the states 1 month at a time funding. So how are you going to do your contracts, and hire your staff when you're only given, and so that's a bad sign. So again, we're going to have to go to the Congress for this one.
I do think there's that's how we have to be strategic too, right? Because treatment is prevention,
right?
And we've worked so hard to connect that. But what I do see is, when we dismantle CDC and there are many organizations that just focus on HIV prevention because, and when you look at the data still, that we still have data, especially around PrEP, folks who are not getting PrEP are Black and brown communities.
Yeah.
And those are the ones that still need all of the efforts that we're making to ensure that we can get prevention efforts to Black and brown and trans communities. And that's where I just feel like racism and all of this transphobia, homophobia is tied in. Because now that we're on the verge of these biomedical advances that are just tremendous, that's why we saw the potential to end the HIV epidemic. But if we don't have the prevention infrastructure that will reach people of color, then we've just lost. We've lost again, and we've gone back.
Let's pivot for a moment to the more global context. We have not only been for decades working on addressing our own domestic epidemic, but we've played a significant role in the global response to HIV. And this particular administration has very quickly dismantled our response by going after our response through PEPFAR and attacking USAID. Talk to me a little bit about how those decisions are already impacting communities abroad and what impact that's going to have on real lives.
Okay, so like for some contexts, U.S. fundings account for almost like 70% of the programs, that UNAIDS implemented, and through PEPFAR and also through USAID. Some of that is direct funding, and some of that is through UNAIDS that distribute to different countries, like that they are coordinating effort to do. We already see a huge cut in these fundings because things ended very abruptly, and so HIV testing, especially in the Global South, had reduced significantly. And not to mention that a lot of the Global South are still relying on the first generations of HIV medications. They've never really had the privilege to get to what we enjoy here, and other high-income countries. And, and so they are experiencing, well, not to mention side effects, but the health outcomes is already compromised because they don't have the resources to get better treatment. And now because of all these funding cuts, it means that more people will have not be able to access these medications. And so let alone the suggestions of having viral load, every 6 months, and so it's very grim, and I'm not gonna lie, and it doesn't look like there's any real light at the end of the tunnel right now, globally speaking, because US has already withdrawn from WHO participations. They didn't even show up in the most recent World Health Assembly, which means, they really were not part of the conversations about what are, the emerging epidemics, what are some of the vaccine development, and also, intervention necessary. So it's actually putting the entire country at high risk. So we already see measles going up in this country. Mm-hmm. We're also seeing, in addition to HIV, because the HIV dollars fund not just HIV prevention and treatment, and also fund hepatitis and tuberculosis, and malaria. So we're already seeing a lot of these being impacted negatively. And like I said, right now, because it's so early, in the administrations, it's difficult to see really the damage in numbers. But that's the place where we actually can still rely on the data collections from, the global community, because we got dismantled, they didn't. So we will still be able to get some of those data from, from from different countries, like to use as references. So that's the kind of silver lining that we're seeing. It's not all bad, but of course it's not good. So, yeah.
So, yesterday, Secretary Rubio said that 85% of the PEPFAR funding is still going out. We'll see. But he destroyed USAID, and we're out of WHO, as Cecilia said. A couple more points. When the American, presence leaves, who do you think is going to come in? And some foreign powers that probably that we don't want to see come in. So it really unstabilizes. It really is, goes against our, our interests. The other thing I've heard is that people are scared that this could happen in the United States. So if the U.S. government is pooling treatment from people living with HIV in Africa, oh my God, that could happen here. So people are just scared to death, that could happen here as well.
Yeah, I think you raise a really great point. People are scared, and people are feeling abandoned, which leads me to my next question: where are our champions? I think a lot of people are wondering, and one of 5 questions I got are, who are our elected leaders? Where are they? Why aren't they showing up? So where are our champions?
I could start.
Yeah.
So, I'm very happy to be in San Francisco today where, you have had great champions like Nancy Pelosi. We wouldn't be where we are today without her leadership. And Barbara Lee as well. And but times are changing. And first of all, we have to remember there's a lot of other groups under attack as well. There are so many issues. It's just not even healthcare. It's, every other issue. So people are being attacked, and they have to speak up for so many different interests and communities that are being impacted. I work in D.C. with a lot of the elected officials, and I would highlight a number of the openly gay members of Congress, Pocan from Wisconsin, Garcia here from California, Ricky Torres from New York. There's several that are speaking up. Just this week, Congressman Garcia led what we call the Dear Colleague letter. It's when all the members of Congress sign on to this letter in support of funding our programs. And we actually got 125 members to sign on. That is higher than, going back to my records, I know in at least 4 years, because we only got 90 last year. So we've been working hard to develop these champions, to speak up. I also have to credit Rosa DeLauro. She is the ranking member. She's from Connecticut on the House Labor HHS Appropriations Subcommittee. She always mentions HIV. She knows what the HIV epidemic was like in New Haven, Connecticut years ago, and still is. And so she always speaks up. But and we have the Congressional Black Caucus as well. But I have to say that we don't. I looked at the list of the HIV caucus in the Congress. I was shocked on how small it was. So that's our job in the community, and to go to the Hill and to educate and encourage them to speak up. We always submit questions for members of Congress to ask, but we have to do a better job. As advocates, they have a lot of, I think there's complacency too, but now that we're under attack, I think now's the time. We also need to build champions at the state and local level as well, because if you're losing federal funding, who's going to make it up? And who gets most of that federal funding? The states and the localities. So they have to speak up as well.
I mean, I would add, of course, and I feel like we're in San Francisco and we have Speaker Emerita Pelosi, we have at the state level, we have Senator Wiener. We have some incredible champions, elected officials, and even locally here, right, in San Francisco. But what I will say is our legal organizations have been phenomenal. When Lambda Legal are representing Tyler, your, and my organization against our lawsuit against the Trump administration. So Lambda and the ACLU, Democracy Forward, there's these organizations are rising up in a way that has given me and my organization and my clients and staff hope. When we felt like we didn't know what was happening and what the traditional ways that we have advocated and fought, but being able to have Lambda say, like, we're going to represent you.
Yeah.
Come on into the tent, right? And it was remarkable. And I just want to just say that, and what I will also say in addition to that is I do think there are the coalitions that we are built, that grassroots folks, that CBOs are building across the country. It's different kinds of coalitions are coming together to ensure that we're uniting, we're strategizing together, we're building power, and I do think that's hopeful to me, and that's where our power can grow and build and actually come up with new ways of resisting.
We got multiple questions from the audience that kind of fall in this same vein. What are our options to close the gap on attacks in the community? What does resistance look like in this Trump administration when they're ignoring even the Supreme Court? And when agencies that we work with, like HHS, CDC, et cetera, are being cut, who do we as everyday individuals call? What do we do as people when we're not like in the legislature or folks that can do big sign-on letters like organizations? So what is your advice?
Okay, so like, I'm going to sound like negative Nancy here. I think that it's great that we have people mobilized to like do letters, writings, to the legislators, but that's not going to help us, to deal with these challenges locally. So organizing locally is really important at this point. So what I mean by organizing locally is to make sure that, you create a group of folks, who you can discuss, ideas, challenges, and strategies with. The more that you can organize locally, the stronger our foundation would become. So this is the first step. We need to build a really, really solid foundations before we try to build it up. Otherwise, it's not going to work very well. The second thing that I think it's really important for us to think about is resistance means we have to do things to piss them off more. So I think the best things to piss them off more is not to forget that we need joy in our life. Mm-hmm. Like joy is a form of resistance. And I'm sure that you've seen T-shirts even saying that. Because at the end of the day, our opponents want us to be miserable. And if we start looking and feeling miserable, then they win. So the best thing to do is to make sure that we find ways to put joy back in our life while we're fighting. Because we cannot, it's kind of unlike 40 years ago. 40 years ago, there's not a whole lot of joy because we have to go to a lot of funerals. We don't have to go to a lot of funerals now. And, and so there's a lot we can celebrate. So focus on things we can celebrate until this insanity is over, because thank God for term limits and thank God for the system we have in place. Yeah.
Mm-hmm. I can't remember all the questions, but I remember the resiliency one.
Yeah.
And, I think we've been fighting hard the last couple months, and I think it's paying off. And it's not just we, it's a lot of people are fighting a lot of different issues. You don't hear Elon Musk's name in the paper anymore, and he's not tweeting much anymore on political stuff. I think, and I just read that Trump's, opinion numbers are way down. It's like 42%. It went down again this week. It's great, yes, to have the Democrats speak up in the Congress, but I also am seeing Republicans now saying, wait, you've gone too far, especially on the NIH research. That's been a real bipartisan issue over the years. But, yesterday there was a hearing with RFK, and the senator from Mississippi was going after him on pesticides and harming their agricultural business. So I do, and I think all the media work as well. I work with a lot of the national media, the healthcare media, but I am so happy to see the media around the country, here in San Francisco, but also, Florida, Kentucky, Alabama. I'm seeing lots of stories about the impact of HIV cuts. So I would say that we are a strong community. I think that we have it in us for years, right? And we're fighting back, and it has to pay off. And I'll use Cecilia's line. Yeah. Also remember, midterms are coming up. We have an election for governor in Virginia and New Jersey this year. And so we will see what happens. We will see what happens in the midterms. Mm-hmm. And so it's don't give up. We have to be resilient. And we'll, hopefully all our programs will still be there, to continue on.
Yeah. I would say, a total agreement, and we still got to fight for those programs. But I would say, and not to forget, like Carl, you were saying, the state and the local level. We still have to ramp up efforts. And advocacy are the ways that we have advocated can still work, and we can't forget that. There was a whole effort that many of my team members at San Francisco Community Health Center were in Sacramento the past few days advocating because of the governor's May revise here. And folks were listening on both sides of the aisle. There was such, it was actually very inspirational to hear from my team members who were talking to folks in Sacramento and really trying to express how important queer health programs and services are. So I would say that, and even just this morning, we were a part of an action right outside of our health center, all around the Medicaid cuts, and I believe that still works. It's about building communities of resistance and building collaborations across organizations and people to actually express why Medi-Cal is so critical. Right, and that's so important for everyone. It gets everyone involved, and we hear actually then the real life impact when services are going to be zeroed out, and that's so critical that we really support the voices of our communities to inform what we're doing and all the advocacy efforts we're making.
Yeah, I think. Sometimes because we're here in California, we do sit somewhat in a bubble because we do have so much more protection than other places. But even in this moment, we're facing unprecedented threats to our communities, including threats from the federal level that we need to worry about. My folks at San Francisco AIDS Foundation would also want me to remind folks that we need our city leaders to step up to protect us. And the HIV Advocacy Network would want us to remember that we need Mayor Lurie to keep his promise to backfill federal funding losses as well. And we would invite and join folks to help by holding the line and by joining the HIV Advocacy Network in their efforts to remind him of that promise. And you can do that easily by texting Fight Cuts to the number 888-272-2848. That's Fight Cuts to 888-272-2848. I want to ask just quickly a reflection, because it was on my mind, but also someone wrote, what can we learn from the fight of the HIV/AIDS movement in the 80s and 90s that might inform our response to the threats in this particular moment?
We all lived through it, so.
Yeah.
Yeah.
I think that that's actually a really key point is we're still here. Like when it was so grim that we didn't really see any light at the end of the tunnel, we persevere, we fought, and we pushed through, and we start seeing like groundbreaking science, being developed and also being used now, in other healthcare delivery systems. And I think that it's phenomenal. But we need folks who have seen that development to help share these stories so that we can create a blueprint, like that also incorporate, that hope, in it. Like to be somebody's living with HIV, I never thought I was gonna see my 30. But in 2 months, I'll be turning 60. So I have already double my limit. And so I'm grateful, and I wouldn't have being able to do that had it not been for the legacy of all our AIDS activists, ACT UP, especially, really organizing and showing up and organizing resistance and civil disobedience, to make sure that people take a pause and look at the entire picture. It's not about lesbian, gay, bisexual, transgender people. It's not about black and brown people. Ryan White was a kid when he contracted HIV, and we named an entire, initiative after him because it's a reminder for us that it impacts everyone. And I think that these are the legacy we can share with all the emerging leaders who's gonna pick up the torch and continue the fight. Some of us are not gonna be here for another 60 years, thank God. But the fight will continue.
But you are here, Cecile, and that's what gives me hope, actually. When you just referenced what we went through in the 80s, we had so many people dying. Our communities were dying. That's not the case right now. We are such a group of committed folks with long-standing years and years of relationships. I just believe that we have what it takes, not just among us, right? We have the strategies. We've been through it. We're going to learn from that. We are learning from it. What I will also say is that then we just heard earlier on the earlier panel about young people who are also part of this fight. And so we have this intergenerational opportunity right now to galvanize together, and we can't miss that, because I feel like that's where we have power, right? We have folks who have been in it, and we have folks who are committed in college, in medical school, post all of the, and they're ready to fight, and we just have to do it together.
I don't have much more to add, but Cecilia, I think, said it, that there's nothing like AIDS activism, right? Every community, every health condition, for years has wanted to repeat what the AIDS community did in the 80s to create change and positive change. And look what's happened and what we've gained. And so ACT UP. And so I think, going back, yes, there's all different types of activism, but we work in the halls of Congress, but work, outside, protesting as well. And I think that is what's happening now. And just this week there were people that were disrupting RFK's hearing, and RFK kills. What was this chant? I don't know, but yeah, they were protesting, and they got arrested and got kicked out of the hearing. But those that type of activism needs to be there as well.
Well, as we start to come towards the end, I guess I'd invite you all to give kind of a closing thought or a silver lining for folks to leave us with, maybe starting with Carl and coming down.
Well, as you can see, I'm not going to give up. We can't give up. We have over 1 million people living with HIV in the United States, and we have to make sure that they get the care and treatment and dignity that they deserve. I think, the Ryan White program, it looks like, it's pretty solid ground. We got issues with Medicaid, Medicare, private insurance. We got to fight there as well. In the area of prevention, we have so much hope that we cannot turn back. And this too shall pass, and we have to get through this period because we're going to win, and so we have to continue to fight.
Yeah, it's been hard to figure out the silver linings. And even as we're talking, I just think reminding myself, us reminding each other that we have gone through such challenges. Mm-hmm. We were all invisible not that long ago, and we fought to be seen and to be visible and to be a part of the queer movement, the HIV movement, and we saw such incredible gains. And so I do think, if we can remember that, harness that, make sure that we're bringing everyone along. And I know that what inspires me is just that there are the smartest, most brilliant, incredible people that are with us, that are fighting alongside us. That, to me, that we will prevail. We will. It's going to be tough, though. I think the path forward is going to be tough, but we do have to think about what is our vision for the next 4 to 5 to 10 years. We can't keep our eye off that future as we continue to fight for our lives right now.
So in addition to all that, I think the silver lining is really we have more emerging leaders who are interested in being part of the movement, as we heard from the previous panel. And also, like I said, not everything's grim. Our president wants to really lower drug costs. That's a good thing. So maybe we should all write a letter to thank him for wanting to lower drug costs and to make that happen sooner. That would significantly, reduce the cost of healthcare. Right? So I think that it's always about balancing. The pendulum seems to swing really, really far right, but occasionally it comes back a little. We just need to make sure that, it continues to come back. And yeah.
So as we close today's conversation, I just want to leave us with a reminder that this moment is not just a test of policy or public health. It's a test of political will, of moral courage, and of our collective memory. We are the inheritors of a movement built in the ashes of government inaction. We're here because activists, organizers, and everyday people refuse to let our communities be disposable. The spirit must guide us now more than ever. And as people sitting up here on this stage today, we lived through the impact of HIV, who led through crises and moments of hope. We know what's possible when we center the people most impacted and back that commitment with real resources and political action. But we also know the cost of silence, and we cannot afford to be silent now. So to every policymaker, every agency leader, every ally in this fight, our communities are watching, our sector is straining. The time for symbolic support has long passed. We need bold investment, unapologetic leadership, and federal government that remembers the human lives behind every data point that we have discussed here tonight. If the vision of ending the HIV epidemic is to be more than just a slogan, it will be because we chose to rise together right now in the face of adversity and dared to finish what generations before us and among us on the stage tonight began. So thank you so much for joining us.